guys, welcome to my channel and thank you so much for continuing to support me and for continuing to subscribe. Now today I want to talk about a condition that is not very much common but is present in the population, and we refer to it as rheumatoid arthritis. I know some of you have heard of the term rheumatoid arthritis, or probably some of you have suffered from the condition. Now about rheumatoid arthritis is that it is an autoimmune disease and an inflammatory disease. That means you have your immune system, which is just the part of your body that helps you to fight off infections and other bad things. So your immune system actually attacks your healthy cells, and then now it causes destruction, it causes inflammation, it makes you to experience different, or to rather have different signs and symptoms. Now, when it comes to rheumatoid arthritis, this condition is mostly going to affect your joints. And when we talk of your joints, majorly the joints of the hand. So around this region, and then also around these joints which we refer to as the proximal interphalangeal joints, and also around these joints. And it can also affect your wrist. It can also affect your joints in the foot. And what happens is that it's like a form of symmetrical arthritis, something that affects your joints. When you have arthritis, it means you have a problem with your joints. So rheumatoid arthritis. Now what happens is that it is symmetrical in that when this joint is affected, this joint is also affected. When this wrist joint is affected, it's also affecting this wrist joint. And what happens with rheumatoid arthritis is that you're going to experience pain around the joints, mostly the joints of the hand. And then you can also notice that the joints of the hand start swelling, so swelling with pain. And this can also affect the joints in your feet. And you can also have, besides the inflammation at your joints, you can also have other things like fever. And you find that the fever of rheumatoid arthritis is like an undulating fever. This is a fever that rises and then falls, rises and then falls like a wave. Now, rheumatoid arthritis is more common in females, and it's not a disease of the old. We will not say that this is a disease that affects people who are 80 years old and 90 years old, so I don't need to worry about it. It's a disease that will mostly affect people roughly between the ages of 30 years and the ages of 55 years. Now, what happens if you have this condition? There are many things that can be done. We have drugs that can be given, and we have supportive management that can be done. So you have drugs that can be given to help reduce the pain, and we also have some forms of physiotherapy that can help you, and we have drugs that can be given to actually reduce progression of the disease. Now when someone has rheumatoid arthritis for a long time, what happens is that they start having joint deformities. So you might find them their thumb looking like a hyperextended thumb, this way, a hyperextended thumb, what we call the Z deformity. You might have them having deformities on the fingers. So you can find the finger either looking like this, or you can find the finger, this joint is flexed like that, and then at this point it's extended. So they tend to have deformities. And you can also find them having deformities around these regions where you find their hands deviated like this. So if they turn their hands like this, you find this how their hands look. And then they can also have like some forms of subluxation at this point. And so you find at this point it's like the hand is bending inside, and then also at the wrist. So just basically deformities that can be noticed. And the thing with rheumatoid arthritis is that it does not only affect the joints, but it can also go to other areas in your body. It can go to your neurological system and present with symptoms, be it depression, be it seizures, be it psychosis. It can also affect your cardiovascular system, your heart, interfere with your breathing. It can affect your respiratory system, that is your lungs, and cause cause fibrosis. It can also affect your liver, affect your spleen, affect your skin. You find that sometimes people with rheumatoid arthritis have really thin skin and even sometimes ulcerated skin. So if at all you have been experiencing joint pains of late, mostly of the hands, and then mostly around this region, and it's symmetrical, meaning both sides are affected, it's very important. Just go and seek medical opinion. Go to a doctor, let them have a look at you, let them test you. And guys, if you have any question on rheumatoid arthritis, feel free to ask, and continue subscribing to this channel. If there's any topic you would want me to speak about, you're welcome. Thank you, I love you, and have a beautiful Wednesday.